We assess now what we call an AP tilt. An AP tilt is basically when the patella is sitting in this position, so that the inferior border of the patella is sitting lower, posteriorly. We are looking at the sagittal plane, where we look whether the patella is parallel to the femur or it has what we call a static AP tilt, anterior, posterior, meaning the inferior border is sitting too low. How do we palpate this? We palpate the superior and the inferior border of the patella. If we can palpate both borders equally, it means the patella is sitting neutrally. But if we cannot palpate the inferior border, but we can palpate very well the superior border, then this means the patella is sitting in what we call an AP tilt, anterior-posterior. And this is what we call an AP statically. If we want to assess whether we will have an anterior-posterior tilt dynamically, we basically ask the patient to perform an isometric contraction. Relax, contraction, and relax. And as you can see here, there is no AP displacement. The patella is gliding up and laterally normally, so no AP dynamic. How do we correct an AP tilt? Which means a patella which is sitting in this position, and where very frequently the apex patella, the inferior border of the patella, is irritating the Hoffa fat pad. Well, basically we want to lift off or lift up the apex patella from the fat pad. So this time we will measure again the quantity of fix we need, the skin protector, and this time we will place the tape not over the patella but a little bit above. So the superior border of the patella is here, the inferior border is here. So we place the tape a little bit higher. Again, a little bit lateral, more tape medially. Make sure now you divide your patella in 4 positions. What we will do, we will place our tape in what we call the upper medial quarter of the patella. We will use again our rigid ENDURA tape, and this time, in order to lift up the apex patellae, we will stick the tape over the superior medial quarter of the patella. We place our thumb over the patella. We will perform this movement so that we lift up the apex and we stick the tape. Make sure you place 2 tapes. For dynamic or for static AP tilt, this is exactly the correction we perform. So again, stick on the upper medial quarter, lift up the patella and stick to the medial side. Once we perform this tape, we need to do what we call the unload of the fat pad. So together with this tape, we need to place 2 more tape to unload the fat pad which is here. Make sure you start just below the fat pad, which means more or less close to the tibial tuberosity. We place 1 tape on the lateral aspect of the patella, meaning starting at this point, more or less 2 fingers below the apex patella. We place the tape diagonally in this way, and the same we do it on the opposite side, on the medial side, in order to unload the fat pad on the medial side. We place 1 tape over the other, Make sure with the tape you're not squeezing the fat pad. Now, doesn't matter whether you start medially or laterally. It's important you start with the tape distally by the tibial tuberosity. Make sure you try to unload by approximating the tissue and by lifting off the fat pad. So this would be for the medial side. And now the lateral side in exactly the same way. We stick the tape once again over the tibial tuberosity, 2 fingers below the apex, and now again we try to do this. We approximate the tissue, we lift off Hoffa, and we stick the tape to the lateral side. So both tape are going in these 2 directions in order to unload the fat pad.